why people panic when they go under anesthesia, when that mask goes on. So let's start with, what are SNRIs? Who here has heard of SNRIs? If you have, let me know in the comments below, and I'll give you a massive shout out, because that has to do with why people panic when this mask is going to go over their face. SNRIs. Who can give me who's going to get that shout out? No, I cannot give you a BBL. No. I've done those surgeries or the anesthesia for them, but not giving you one on TikTok, sorry. It's a good one. So SNRIs are medications that we use for depression, sometimes for anxiety, because they increase the level of, in addition to serotonin, norepinephrine. Norepinephrine, guys, is one of the flight or fright chemicals that your brain produces, and it comes out of other parts of your body. It revs up your heart. So like, people come in right now, my heart rate and my oxygen is super low, I'm chilled and relaxed, but patients come in, I routinely see people in the 90s, 100s, 110s. And why do they do that? Because I'm telling you, part of it is because of an addiction cycle. Remember, addiction by definition, guys, what's the definition of addiction? Because you need to understand the definition if you want to be able to address it. And remember, this is not just addiction for substances or gambling. We're talking about internet use, things that maybe like you're doing stuff that keeps you from going to bed early, addictive eating. There's so many parts of it to addiction. But the definition, you'll see why it has to do with anesthesia and patients that panic before going under, right? It is anything that gives you short-term pleasure at the expense of long-term harm that you can't abort. All right, I'm going to say that one more time, and I want you guys to think about it carefully. And what it has to do with SNRIs, people panicking under anesthesia. Have you ever had a panic attack before? This is really important, because this is the whole point of what I'm getting at here. The definition of addiction, something that gives you immediate pleasure, however temporary, at the expense of long-term harm, and you can't abort. You're stuck in the cycle. So that's the definition. So when people come to the operating room, what's going on? They naturally get terrified. I get it. We're in an operating room right now. For our TikTok viewers, this is the OR table here. This is the operating room. Sorry, on YouTube, I can't move the camera, but we're in an OR. This setting induces anxiety, and our comfortable place when we have anxiety is to try to get control. How do we get control? Well, a primitive way is to go into the flight or fright response. So you literally increase all of your catecholamines, which, by the way, when we said SNRIs increase to an extent, among other chemicals, some of your catecholamines like norepinephrine. We actually use norepinephrine in the operating room under surgery. I don't have any here in my graveyard of medications today. I didn't have to use it, but we have some similar medications, like I use this guy here, some phenylephrine related to norepinephrine. But the point is that you want to get in control. It's your comfort zone, because nobody likes to feel stripped of all their control, especially when you're going to go under something terrifying like anesthesia. When that mask is about to go on, we want to get some control. So we go to our comfort place, which is being in control with catecholamines, serotonin as well, norepinephrine, epinephrine, etc. Now, why did I bring up SNRIs? I'm not saying people that take SNRIs are addicted to them, but I'm saying that same chemical in the brain, we use medications to increase because it gives us some relief from anxiety and depression. You following me? So, yeah, someone's telling me Versed helps. Okay, so we just talked about something really powerful, and I'm going to contrast that from one of the powerful compounds here, this guy, right? So if you guys are appreciating what I'm talking about, which is how to overcome your fears, anxieties, panics, PTSD naturally without these medications, hit that subscribe button, follow to keep up. Remember, this is going to go on YouTube, so all the recording will be up there if you missed anything. So I'm telling you about addiction. SNRIs save lives, someone says. They can. They absolutely can. What else can save lives is you learning what your addiction cycle is like and being empowered to get out of it. And when you're going under anesthesia, I can totally chemically sedate your brain. Absolutely. I can do it all the time with this medication here or with this stuff here. 100%, right? I can do it, but it's not going to help you in the long run. When you overcome it on your own, you have a better recovery. Someone here is just saying that the recovery is harder than the surgery itself, and I can't agree more, because the recovery is when you are put to your limits. You might be in pain, you might not have independence because you can't walk on your own, you might not be able to do your activities of daily living because you're recovering from surgery, and that's what's pushing you to whatever resilience you have as a foundation. That's what I'm getting at. And patients that have an addiction cycle where they need to get that temporary dopamine rush so they can continue, might not be able to keep getting that, and if they do, it's going to give them long-term harm. Now let's take this out of the operating room. Yeah, we do go to sleep in the operating room with our medications, but there's more than that. What about things that prevent you from going to sleep, like internet use? Like, have you ever used social media in bed and it's like, man, I really should put my phone down because I know I'm going to regret it tomorrow, right? You know what I mean, right? So by our definition of addiction, which, just to remind you, if you weren't here for that part, the definition of addiction is something that gives you temporary relief, temporary pleasure, a dopamine rush. Literally, you're pulling down the thing of the jackpot, of the gambling, of the slot machine there. Temporary pleasure, but long-term harm. So when you're in bed on your phone, you're on your phone and you're getting some dopamine rush from being on your phone, but you know you're going to regret it tomorrow. You know you're going to regret it maybe next week when you're sleep deprived, right? This is one example of many. Same thing goes for overeating, addiction to, promiscuous activities, if you know what I mean. I can't say them here because the live platform won't like it if I say those words, but you know what I mean. So we need to not look at addiction as people that are just hooked to these things, and it's far more than just chemicals that people get addicted to, right? It's everyday activities. And you or I could very easily fall into that, right? Our brains will get hijacked by mechanisms that try to take advantage of them. 100%. I love how people are saying here, I know what you mean. I mean, people are relating. I'm so happy that people recognize this. People are saying food is one. Absolutely, food is one. So the point is that it's not like us versus them. Oh, addicted people are so different. No. Any one of us could fall into an addiction cycle if we get the right dopamine rush at the right time, and we can have long-term harm from it, but as long as we get neurocognitively hijacked, we fall into that cycle. So when we're treating patients with addiction, or if I have someone who's got addiction, let's say, to needing that sense of control, it doesn't do me any good to be like, oh, that addicted patient. No. It's like, guys, we're all connected. And I know it sounds cheesy to some people, but until we break the stigma, we're not going to be able to help anyone. And if it's before surgery, I would much rather start to address the underlying concept of addiction, why they're so panicked, why they're so stressed, why they're having a panic attack on my OR table. If we can even begin to address that, once a little bit of anesthesia goes on board, that helps the innate healing potential kick in. And that is what I want us to recognize tonight, that it's not about addiction, it's not about, hey, Heidi, good to see you. It's not about, alienating people with addiction. Any one of us can fall into that, and unless we have the right compassion to understand why they've fallen into there and try to help them recognize what's going on, what the addiction is a symptom of, we're not going to do anyone right, and heaven forbid we fall into that kind of cycle, we're not going to be able to get ourselves out of it. Does that make sense to people? I hope people appreciated that. And anyways, I want to change gears a little bit. We'll answer a couple of questions. I just want to remind everyone that if you're appreciating the message, hit that like button, follow, keep up with all my lives. This will be on YouTube, same handle there, Medical Secrets. And yes, this is me on the monitor. I've connected myself to the EKG to show you a couple of those powerful techniques that I do to help regain control of my body so that I don't get dependent on needing that fright or flight response for that temporary pleasure in moments of fear at the expense of long-term harm, right? That was the definition of addiction. Temporary pleasure at the expense of long-term harm that you can't abort out of the cycle because you're addicted. You keep following that cycle. So, can I explain junctional rhythms? Absolutely, sure, fine. We'll change gears. We'll talk about my EKG for a hot second here. This is my EKG. You see how there's a narrow spike on there? Everyone see how narrow that little spike is? When you have a junctional rhythm, that spike is wide. It means that that spike is coming from the ventricles, not the atria. Hope that answers your question. Sherry, Peabody Sherry. How do we stop the cycle? Great question. You stop the cycle of addiction by recognizing that addiction, guys, this is so important, so important. Addiction, very similar to depression and anxiety, is a symptom. We make a huge mistake in Western medicine, and I love my psychiatry colleagues. I love the psychiatry teachers I had when I was a medical student at Stanford. I mean, they were amazing doctors. But the way that I learned it, maybe I interpreted it wrong, I don't know, but most people interpret it as a diagnosis. When you're depressed, you have a diagnosis, and I argue that it's not the case. It's a symptom. Anxiety, depression, even diabetes, heart disease, these are symptoms. Sure, some of them are diagnoses, but they're symptoms. Some people are saying that I don't answer the questions. I'm so sorry. Dreadful artwork. I'm not ignoring your questions. I promise. I'm just trying to keep up. If you want to get your questions answered, you can check out the links in my bio for where I have a sign up there for the more premium lives that you can do with smaller group sizes that we can actually answer one-on-one all the great questions you all have. So be sure to check those out. And remember to hit the follow button. Your support helps me do this more often. Even after a long day in the operating room, I want to come on here so that you guys can learn more about your body and the stuff that I never learned in medical school at Stanford or residency at Harvard, and stuff that maybe you don't know about your body either. So you can hopefully live your life better without medications. Can we discuss POTS? We can. I've talked about it before. If enough people want to talk about POTS, I'm happy to do a quick demo of it. Okay, well, Heidi says POTS, we'll do it. So, this will come back to our talk on addiction and anxiety and panic attacks. I promise. Don't sweat it. Don't worry. We'll get to it. So, our nervous system has incredible control from our thoughts, right? POTS is not necessarily something we can control, but the concept of it, I want to demystify for people. So look at me on the monitor here, okay? This is my EKG, right? I'm connected. There's no patient here. If I do certain maneuvers, I can modulate my heart rate and, to an extent, my pulse oximeter, which is my oxygen saturation. So you can do this with me, guys. Check it out. So guys, no compounds. I'm not using any of these. This is just using my own mind and how I breathe. Valsalva is one way of doing it. It's not the only way, but check this out. I'm going to put my hand on my chest. And if you all want to do it, go ahead. I put my hand on my chest. Sorry, the microphone's probably going to get a big boom there, right? Put my hand on my chest. I'm going to breathe without moving my hand. All right? And if you guys are learning something, hit the like button and share with others. Your support does mean a lot. I do appreciate it. So, I'm breathing without moving my chest. Now watch my heart rate. Watch the green spikes. Let me raise the volume so you guys can actually hear. Right? I'm trying to be connected with y'all. Once again, at the expense of sounding corny, I want you guys to have a window into my body. That's why I connect myself to the monitors, so you guys can see what my body is doing when I do these demos with you. All right? We need to all be more connected in this world. And that's what I'm hoping to do on these live sessions with you. And I hope you appreciate it. So, oh, I love the kind comments. Thank you, everyone. So I'm putting my hand on my chest. Right? Not being symbolic, touching my heart. No, it's just practical here. Because if you can breathe through your belly without your chest moving, you're going to activate an increase in your heart rate variability, an increase in your parasympathetic tone. So watch as I breathe. I breathe in for 5 seconds and out for 5 seconds, trying to minimally move my hand. 1, 2, 3. Did everyone hear that? Did everyone hear that? Did everyone hear just how much I changed my heart rate with that one breath? Can I talk about hysterectomies or gallbladder surgery? I can, but let's not jump topics too quickly here, guys. So my heart rate went down and it went back up. It went down and went back up. Right? So hit that like button, guys, because we're going to talk about how you can activate this as well. The other day I did a demo on myself with my heart with the ultrasound, and I showed you how my heart, the cavities in my heart change with my breathing. Right? I caused the ventricles on the one side to get bigger than the other based on how I breathed. Those changes in the size of your heart also change your heart rate and change your heart rate variability. So let's do it one more time. Once again, hand on the chest. Guys, and there's not a patient in the room. I'm not violating HIPAA. It's just me, window to my body for you guys to learn. That's what I'm here for, all right? So let's do this one more time. One, and let me stop moving my hand that's got the pulse oximeter on it, okay? Hands on my chest. Hey, Alex, good to see you. Okay. Panic attacks, damn it. Oh, guys, we have a very good question here. Hold on. Let me do a quick break from this exercise because somebody here on TikTok asked, Shy Blonde asked such a good question that's so relevant to what we're doing. And I really want to take a moment to bring this up. Malern64, thank you for the kind words as well. Okay, so Shy Blonde said, can panic attacks hurt your heart? So earlier I was talking about addiction, right? We defined addiction as short-term pleasure that has long-term harm, and you can't abort the cycle. Now, one of the chemicals that comes up when we feel like we lose control is epinephrine, norepinephrine, your catecholamines, your flight or fright hormones, right? Salivary cortisol, et cetera, et cetera, et cetera. I don't care about the chemical name so much anymore because when I have a patient on the operating room table who's having a panic attack, who is claustrophobic because this mask is freaking them out to the point where they're completely out of whack with their physiology, and anesthesia might not be as safe or as pleasant for them. I don't care what chemicals are going on. I don't care if it's epinephrine or norepinephrine or lack of serotonin or whatever. I care about the patient and how they ultimately feel, because how you feel before anesthesia determines how you're going to wake up. I don't care what the chemicals are. I'm not going to measure a salivary cortisol. I want them to feel like they have control without needing to resort, whenever possible, to the medications that I showed you earlier, because they all have side effects. Now, what does this have to do with panic attacks in the heart? Because those chemicals that are released that help give us the sense of control, those flight or fright chemicals, similar to the ones that we use under anesthesia, sometimes for life-saving purposes, those over time can damage the heart. Excess levels of epinephrine and norepinephrine and cortisol likely do have when in excess, when